A good surgeon in 1800 could amputate a leg in under 3 minutes. The record was 90 seconds. If you screamed or passed out, that was just part of the procedure. And that was the least painful thing on this list. Let's start with bloodletting, the most common medical treatment for over 2,000 years. If you had a fever, they cut you. If you had a headache, they cut you. If you were dying, they cut you more. George Washington died from bloodletting. His doctors drained nearly half his blood volume in 12 hours. They were trying to cure a sore throat. Trepanation is even older. Drilling a hole into someone's skull to release evil spirits or pressure. We have found trepanned skulls from 7,000 years ago. The terrifying part is that many of them show signs of healing, meaning the patient survived. People walked around with holes in their heads, and some of them asked for the procedure again because they felt better afterward. Bladder stone removal was a special kind of nightmare before anesthesia. The surgeon would insert a metal tool through the urethra, locate the stone by feel alone since there was no imaging, and then make a deep incision through the perineum without any pain relief. The patient was held down by 4 strong men. The record for speed was held by a surgeon named William Cheselden, who could complete the entire operation in 54 seconds because the faster he worked, the less the patient suffered. Most were not that fast. Amputation was the most common major surgery for centuries. In battlefield conditions, the surgeon would saw through the limb while the patient bit down on a leather strap or a bullet. The pain was so intense that many patients died of shock before the bleeding killed them. The best surgeons were measured by speed, not precision. They became famous for how fast they could remove a leg. Mastectomy, for breast cancer, was performed without any pain relief well into the 19th century. The surgeon, Fanny Burney, described her own mastectomy in 1811 in a letter. She was conscious and unmedicated for the entire procedure, which involved cutting through skin, muscle, and tissue as she watched. She survived, but she wrote that she could still hear her own screams in her memory until the day she died. Tooth extraction was performed by barbers, not doctors. The barber surgeon would pull teeth with a tool called a dental key that looked like a torture device, because that is essentially what it was. The key would be placed over the tooth and twisted. Often the tooth shattered, leaving fragments that would rot and cause deadly infections. Without antibiotics, a tooth infection could kill you within days. The worst procedure on this list is one you have probably experienced yourself, but without the part that made it unbearable. Cataract surgery, known as couching, was performed for thousands of years by pushing the clouded lens out of the line of sight with a sharp instrument. The patient was awake, staring at the needle coming toward their eye, and they had to remain perfectly still. If they flinched, they went blind. Even if they stayed still, the success rate was maybe 50%. Caesarean sections were not designed to save the mother. They were designed to save the baby when the mother was already dead or dying. First recorded C-section in which the mother survived was performed by a Swiss pig gelder named Jacob Neuffer on his own wife in 1500. He had experience cutting open living animals quickly, so he applied that knowledge to his wife. The development of anesthesia in the 1840s changed everything. The first public demonstration of ether anesthesia was in 1846 at Massachusetts General Hospital. The surgeon removed a tumor from a patient's neck while the patient felt nothing. When the patient woke up, the surgeon turned to the audience of skeptical doctors and said the most important 4 words in medical history. "Gentlemen, this is no humbug." Within a decade, anesthesia was standard practice for surgery. But it took decades longer for doctors to understand infection. Joseph Lister introduced antiseptic surgery in the 1860s, and for the first time, a patient could expect to survive both the disease and the treatment. The people who endured these procedures without anesthesia were not weaker or braver than us. They were the same. They felt exactly what you would feel. The difference is that they had no alternative. Pain was simply part of life, part of medicine, part of dying. It was not considered a problem to be solved. It was considered a fact to be endured. The next time you get a filling, a root canal, an injection, any minor procedure that would have been torture 200 years ago, remember that the only difference between you and the patient who bit down... Subscribe for more history that makes you grateful to be alive right now.